Hello, my name is Kenzie Leesberg, and this is my presentation on the Michigan CKCC workshop for Competency A. Competency A is stated as follows: demonstrates knowledge of best practice to promote the health and safety of young children at home and in early learning and development settings. So this image kind of gives a little breakdown of the CKCC. There are 8 different core knowledge and competency areas. And the one that we're going to be focusing on is health, safety, and nutrition. Each of these areas has different statements, and then each statement is blocked down into 3 indicating levels, which are developing, achieving, and extending. So this very first link is for the National Resource Center for Health and Safety in Childcare and Early Education. The link is nrckids.org, and if we scroll down here, it kind of talks about caring for children, achieving healthy weight, and then the different state regulations, all of which are very important to this competency. So here we have another image, kind of a visual of the breakdown of the CKCC. Like I had said earlier, we're going to be focusing on health, safety, nutrition, and then the dispositions and skill knowledge into developing and achieving. The second link is for the Kaplan Learning area on creating a healthy classroom environment. And I just really appreciated it because I thought that it included some information that's often overlooked, I feel, in early learning settings, such as like window shades and blinds and the entrance to your classroom, like things that I feel the normal average person wouldn't really take into account, but is obviously very important for this area. So diving deeper into the health, safety, nutrition competency area, there are A through E statements, and we're going to be focusing on A. So here is competency A broken down into developing and achieving. Competency A, once again, demonstrates knowledge of best practice to promote the health and safety of young children at home and in early learning development settings. So it goes over things such as like wellness activities, precaution procedures and Red Cross, responding to children's needs, reporting illness, and implementing a program that we all need to be on the same page for the support and improvement of each children's health. And that being said, I liked this image very much because I feel like hand washing for children is sort of not really like a game, but they really enjoy it. They get to be literally hands-on and hands-in with their caregiver or their teacher, whoever is designated for that child. And I just thought this was a great picture because of how happy this father and child look. They're having a great time doing something that is really healthy and stops children from being exposed to different dangers and germs. And it's just something that if you can start it young, you're going to do it the rest of your life. And I feel like it's something important to talk about. And so on the right here, we have the health, safety, nutrition wheel. It goes over program standards, early learning, regulations, and then the quality improvement rating system. This link that I'm about to click on is a very telling video about the Joanna and Brian Lawson Center for Child Nutrition, which was recently opened in Toronto, Canada. And I know that's not in the United States, but I felt like Toronto's new building that they've created for this is very insightful, and I think they provide a lot of good information.
I'm Dr. Mike Evans, and I want to take a few minutes to reflect on healthy eating, especially with respect to kids, and tell you about a brand new organization at the University of Toronto called the Center for Child Nutrition, Health and Development. So let's step back for a second. I think it's pretty clear our current nutritional system is broken at both ends of the continuum. The Food and Agriculture Organization's 2013 count revealed that approximately 850 million people are hungry And at the other end of the continuum, 1.4 billion are overweight or obese. And there are paradoxes within. So, for example, in industrialized countries, the poorest and hungriest are most likely to become obese, to develop diabetes, and have strokes. Many are simply struggling to put food on the table. 8% of Canadian families and 1 million Canadian kids are food insecure. Many other families are trying their hardest, but are challenged by understanding the best way to eat and then knowing how to make that happen in the real world, all of which drives or prevents the multiple chronic diseases I see all day in my clinic. I also think the public has in many ways been poorly served by nutritional research, where too often the emphasis has been on a very narrow subject, such as one nutrient, with a very narrow population. The findings from this research can help build theories, but for the public it can often lead to confusion and distract us from the big picture of the cascade of behaviors that make up a healthy life. The Ontario government has recently said they want to reduce the prevalence of excess weight and obesity in its children from 30 down to 10% within 10 years. And we think to realize this, our approach needs to change. The Centre for Child Nutrition, Health and Development at the University of Toronto is being built to rethink this cascade and build innovative solutions to help kids and their families eat better. A centre that informs individuals and neighborhoods as well as local and global policy. A platform that brings together research institutes like the Li Ka-shing Knowledge Institute at St. Michael's Hospital, the Fraser Mustard Institute for Human Development, and the Hospital for Sick Children. Fusing science with care, examining food supply, as well as redesigning medical education across university departments such as nutritional sciences, pediatrics, and family medicine. To bring best practice out of academia into the community where 30% of Canadian kids are overweight or obese, contributing to a population of Canadians whose healthcare costs our system more than $7 billion per year. To take this macro approach, the CCNHD will need to focus on the population that promises the greatest impact, and that window is childhood. For example, we used to see brain development as a fixed process where a genetic blueprint simply unfolds. But now we see a much bigger picture where genes are certainly important, but that your brain actually physically and functionally changes, what we call brain plasticity, with nutrition and experiences, which in turn provides an opportunity for an incredible return on investment down the road. To create a new platform, you need a new team that speaks to this future. So for example, our microbiome, the trillions of microorganisms that live in our gut, mouth, skin, and elsewhere in our bodies that help with digestion, prevent disease-causing bacteria, and can nourish our cells. Your microbiome is laid down primarily in early childhood, and the CCNHD has just awarded the Lawson Family Chair in Microbiome Nutrition Research to Dr. Alina Comelli to explore how we can program our biomes to prevent future illness. It's pretty cool. When they asked me to join the CCNHD, I said, but I'm not a superstar nutritional researcher. And they said, true. But instead of being a center that just invests in more research, maybe we also need to invest in curating and explaining the best nutritional research to the world and make it easier for the public to understand and act on that research through YouTube, primary care, social networks, and so on. Food has a ripple effect in our society. Sure, on the one hand towards too much and too unhealthy, but on the other hand, food brings together families, builds communities, and gives us health. CCNHD wants to build a new platform that explores this balance, especially with respect to our kids, and tips it towards health. So thanks for listening, and we really hope you can get involved with the Center for Child Nutrition, Health and Development.
So here I just wanted to point out the Michigan State Board of Education's research and their document on the early childhood standards of quality. Over here we see a very, very cute book cover of different activities that are very healthy for children, and as we can see, visiting the doctor is a great part of this, and as we just learned in that video, it can also impact not just the child but their family as well. So here I wanted to point out the Joanna and Brian Lawson Center for Child Nutrition in the University of Toronto, and this is where you can go to learn more about their, like, what they stand for and all those good things, and also they have research and education links that you can go into if you want more information. So the area that I want to focus on right now is the social, emotional, and physical health and development, or SEP. And it kind of goes over these 3 different bullet points on healthy eating, healthy choices, and personal safety. So here's a chart that I made to go over what children experience. We want to talk about um, how to create a safe place for these kids to talk about their problems and not being suppressed with fear or concern with repercussions. Like, that's not what this is about. We need to make sure that everyone's included, everybody is seen on the same page, and we're not singling anybody out, because that is very damaging to children. And for teachers and adults, what they can do is not only restrict screen time, because that's a good thing to make sure that kids aren't getting too sucked into, but you also want to focus on regularly assessing and reviewing the children's goals, because everyone's going to be starting at different levels. You don't want to come in with this thinking that every single child has the same problems and you're going to fix them. Like, that's not what this is about. But as long as you can implement as many of these as possible into your classroom, this and this, you're going to end up with this result, which is exactly what should be focused on for health, safety, nutrition for competency A, since it's all about best practice. Like, this isn't just one solo event. We want to make sure every child is given the same opportunity, even if they don't need the same amount of resources as another child. Here are my sites and sources, and the link to the quiz. Thank you so much.